Welcome to the Dementia Caregiver Talk Show, a podcast to help you navigate the senior care maze. Learn and laugh with us as we discuss creative solutions and ideas to common and uncommon dementia care challenges, and how to make sense of the senior care industry and options, even if you're not a professional. Hello and welcome to the Dementia Care Partner Talk Show. My name is Valerie and I'm here with Teepa Snow and Joanne Westbrook. Hello ladies, how are you?
How are you?
Hi.
So we got an interesting topic today, and it's sort of, at our last episode we mentioned it because the question came up and it's about vascular dementia. So today we talk about what is so unique and challenging about vascular dementia.
So Joanne, that's something that you have a lot of personal experience with right now because you have a sister and you're trying to support and help her, and that's the type of dementia she's living with.
Right.
Yeah. So what have you noticed about her that really makes it hard for you to support her? And then I'll go through sort of what are some common symptoms. I'll talk about that, but tell us what you've noticed being her sister.
Right. Well, my sister, first of all, is very good at covering.
Mm-hmm.
So if somebody new comes in the room, she perks up and seems to be perfectly fine. And things are going very well. And then when that person leaves, and I will give you an example, her daughter is the one that moved her into the facility, and she has never gotten over that. And she's angry with her. And so she's the only one that gets the negativity because she's associating that with her. So one day she's fine, and then the next day she's just off the chart, all upset, a lot of anxiety, and then there's depression. So she's going through a range of mood swings that are within the same day sometimes, which is very hard for my niece to be able to navigate.
Yeah. So one of the things about vascular dementia is it's less about a predictable brain failure pattern and a lot more about problems with blood flow to a variety of sections of the brain. And classically with vascular dementia, how people are doing in a moment is highly dependent on vascularization in that moment. So things like blood pressure shifts, blood sugar shifts, emotion states, because what happens is the primitive brain triggers and shifts and sends chemicals and hormones flying around. And so what it means is when somebody has vascular dementia, they can go from the term I use is Dr. Jekyll to Mr. Hyde in like, whoa, what happened? And they can also vary within a situation, but they can vary from morning to night, day to day, situation to situation. And the other thing is that sometimes when they're in a good place, it's like, whoa, they're fine. I mean, maybe they don't need as much support. And then in 10 minutes, you're thinking, I don't know that I can manage this anymore. They need so much more help. And it's not, unless they've had a stroke, it isn't necessarily that much physical assistance initially. It's often more emotional support because the variable emotions, but also sometimes intellectual capacity changes dramatically along with how I behave myself. But being able to manage myself in a social situation when I know it matters can kick me into external behavior solid. When I feel safe is when I might have my meltdown, because when I'm with the person I trust the most, when I'm with the person who I feel like should be there no matter what, that's often when my brain feels free to go, I'm not putting up with this. And yet the next time you see me, I might be perfectly lovely. And the emotions can go from flat to very, very excited, to very, very sad, to very, very anxious, to very, very angry, to very, very scared or frustrated, to being surprised about things that we just talked about it. And so that immediate recall can flip on and off. And so what it means is for the people around, it's like you have to take somebody's temperature almost constantly, but you can't be obvious about your temperature take. And the thing about with vascular dementia is A plus B rarely equals C. I mean, it's A plus B equals F. Well, now A and B won't even add up. And so you're feeling often like, well, I did the same thing I did last time, but I'm getting a very different reaction or response this time. So it's one of the dementias where I'll say if things are going badly, sometimes one of the very best things to do is say, I'm so sorry this is happening. I know you're angry with me, and simply step away. Leave the person for a bit, because as long as they can see you and they're trying to interact with you, all you're doing is stirring their emotional pot.
Right.
So if you give it your best shot and it just feels like it's getting worse, not better. She is now yelling and throwing things at me. You know what? I get it. You are so angry with me. You can't see straight. I'm going to get out of here. You don't want me here. You don't want to talk to me. You are so angry with me. I'm going to go out. Now, you got to be careful. You don't want to say, I want to go home, if the whole argument was about, you have no business putting me here. How dare you? And you stole this and you did that. So we aren't going to go home, because, that would just be fuel to the fire. But stepping away, and then maybe 15 minutes, knock, knock. Now, we did talk about that one. Knock, knock. Look, I brought you a Coca-Cola. I brought you a Pepsi-Cola. I brought you a Dr. Pepper. Whatever your favorite thing to eat or drink is, frequently, to be honest. Whatever your favorite thing to look at. So things to taste, things to touch, things to look at, things to listen to. You come in as though that last event did not happen.
That's perfect. And that's the one thing that she has learned to do really well. Mm-hmm. The other one that is really difficult is the mixing up of time and episodes.
Yeah.
And so, unfortunately, my niece was telling her about the wedding. And then all of a sudden, she has decided that she's in charge of the wedding. Everybody's going to come to her place. And, I'm telling you, the anxiety was off the chart.
Yeah. So you were thinking, so we're going to have it at your house. Wow, that's going to be huge on you, Mom. Are you sure that that's something we should do? It just doesn't, it feels like I'm putting a huge burden on you.
Right.
I mean, that's a lot. Oh my God, I didn't realize you were thinking about doing that, because we were thinking about maybe like a hotel reception thing, because that just seems like a lot.
And so that has been one of the issues that she tends to forget, and that is, don't call her and tell her you're coming down.
Yep.
Because when you're not there in the time she thinks you're there, she is standing outside the door waiting.
Yeah. So one of the things that can happen frequently with vascular dementia is, because it's affecting the hippocampal and the thyroid. It affects the thalamus. It affects so much of your brain. Off and on, is it messes up your time passage awareness. And so when you say, I'll be there in a half hour, 5 minutes later, well, where are you? I thought you were going to get here. And it's like, I'm on my way. Well, what's taking so long? Because I can't hold time. So the idea of calling ahead is a bad idea. You want to say, learn the art of saying, hey, I meant to call you and I totally forgot, but I was on my way and I just thought, what the heck, I'll just stop by.
Right.
So appear when you appear. Don't warn of coming, because then that time expectation starts. And if I really want to see you, you're taking way too long to get there. If I am anxious about seeing you, I'm nervous about it because I think you're going to ask something of me or have me do something that I don't want to do, then when you get there, what you have is a Mount Vesuvius already, which is, I'm not going to that. I never said I would go. And it's like, what are you talking about? I'm just coming by to visit. No, you said we were going, and all of a sudden I have in my mind that you're going to get me to go do something, or I'll have an appointment, because time to me is a scary thing. I can't hold on to it.
So I have another question. my sister was actually initially diagnosed with Alzheimer's. And I'm the one that noticed the vascular changes, the things that were happening, because I knew she'd had 2 small mini strokes over the few years.
Right.
Physically, she's fine, but she's getting more confused and starting to have a little bit of language problems. And so I was wondering, I know you've talked about mixed dementias.
Yeah.
And they hang out together, as you say.
Yeah. The bad news about vascular is it is inflammation and irritation of blood vessels, but the blood vessels are right next to the brain nerves. So there's this risk that apparently one can really irritate and cause the other one to activate if there's probability, or if that gene code and everything else is right. And of all the dementias, the 2 that like to hang together the most is Alzheimer's and vascular disease. So you can start with Alzheimer's and develop vascular, or start with vascular and then develop Alzheimer's. So you have a primary of one, but then the other one, the abnormal protein of Alzheimer's, starts sort of doing its thing and accumulating. And unfortunately, both of them tend to get pretty active in the hippocampal region and in the wiring that allows you to think straight, to be logical and reasonable, and to find your left temporal lobe language skill set, which is hardwired into that hippocampal sort of complex. So it's pretty common that you'll see one add the other. So after a couple years of one, it's not at all uncommon to start to see things sort of escalate or start revving the engine a little bit. So you see now a secondary phenomena starting to show itself.
Yeah, I was going to ask you about anxiety medication, depression medication, and how scary. I mean, not really knowing when to take that on and how much, because I don't want her to be over medicated. And right now, she's not on anything except blood pressure, I think, medication.
Yeah, blood pressure medication, because her primary issue was one of hypertension and managing the blood pressure. Right. But now we're seeing when she gets really, really anxious, her blood pressure is shooting up and her heart rate is going up. And so it's like, yee. But at the same time, frequently people say is, like if you think a shot of alcohol would help, I mean, that's basically when you do an anti-anxiety drug. A lot of anti-anxiety drugs sort of act like a shot of alcohol. Right. They're a little different, but it's sort of like what alcohol does is it both sort of numbs a little bit and it gives you a little energy bump. So you're feeling better. The problem with alcohol and anti-anxiety meds is they impact the chemistry in the brain. So one of the things to wonder about are there other strategies that she does well with? Is she comforted by conversation with certain people? Not her daughter, probably, when she's frustrated. But are there other people that she could, when she says, well, I don't know when she's going to come. Oh, so you're not sure when she's coming. Did you need to tell her something, or you just want her to get here because it seems like she's late?
Yeah, she definitely is a people person. She's also an extrovert, a nurse practitioner who was a caregiver. So what we see in the facility, which is amazing, is she is the nurturer. She runs around. If somebody's in a wheelchair, she's the first one to take them in the dining room. So that part of her just kicks right in. That part she loves, and she loves animals, dogs particularly. But those kind of things are very comforting to her to be needed, as you say, how important that is.
Yeah, she needs to feel like she has value and purpose. I wonder if there are any programs nearby that she might have access to transportation where she can volunteer at a shelter, at the animal shelter, to go and do animal stimulation, like caring for the animals, like just spending time with them. They have a couple programs nationally, and again, it's individual locations where they do kitten care or they do puppy care.
Right.
And one of the staff or the engagement coordinator arranges with that for them to do some puppy loving, because and some socialization for puppies or little dogs or little cats, so that they're more adoptable.
Right, and that has definitely triggered her to want to have she said you wanted a kitten, a cat.
Yeah.
Yeah, so, a lot of it, we do have the activity director there has a puppy. She brings it with her to work every day. So that's kind of when Betty gets a chance, that dog is in her lap. That's the first thing. So,
there you go. So that's a big comforter right there. And so looking at that, maybe a weighted blanket or a weighted vest, sometimes that's an anxiety reducer, just as it is for people who have autism. They find that putting some weight over the core of the body, the trunk, can actually calm people a little bit sometimes.
Oh, okay.
So something a little heavier. Not hot, but a little with a little bit of weight to it. So they're called, or neoprene or, fitted vests, that something that gives you a little tension, a little pressure on your trunk can take the anxiety away.
Nice. Thank you so much, Teepa. I really appreciate it.
You're welcome. Vascular disease is a challenge for sure.
Yeah.
Thank you so much. That's very helpful. And I will take those ideas and bring them to my niece.
Good. And what your niece may need is taking some deep breaths and
yes,
finding her own support, because it can be pretty lonely being the daughter that whenever you go, you feel like, I don't know what I'm going to face. And so it's called anticipatory distress. So she goes into it a little anxious herself.
Yes, and she just recently lost her biological father and her stepfather within 2 months. Ouch. So that was a little stressful right there.
Yeah, so she's a little stressed out to start with. So things her mom does is going to make it a little harder for her.
Right. I will remind her what you said, however, about that she's the person that she feels most comfortable with and will let her anxiety, and that might not make her feel good, but at least she knows it's because she loves her.
It's because her mom actually trusts very deeply that there will always be a relationship there. And so that she doesn't fear the loss of the relationship, so she can let go with both barrels, unfortunately.
That's right.
Sorry, go ahead.
No, that's all.
I was just going to throw out for our listeners, if you're interested to learn more about vascular dementia, I know we have a DVD on vascular dementia, and I'm very, very certain we have a webinar too.
We have an excellent webinar. Thanks for reminding us. Yeah.
So, for our listeners again, if you'd like to browse that, our website is www.teepasnow.com. www.teepasnow.com. All right. Well, thank you, ladies. Very much appreciate.
Thanks, Val, for the opportunity, and Joanne for the chance to talk about what can be a real challenging situation for sure.
Yeah. Thank you so much, Teepa, and thanks, Val.
Thank you.
You're welcome.
See you next time.
Take care. Bye-bye.
Bye.